Waldeck Health Source of Decatur. Today I want to talk to you guys about lower back pain caused by spondylolisthesis. Okay, so let's go ahead and get right into it. We're looking at two pictures of the spine from the side. So we're checking out the lower back here. This way is forward, that's the back, okay? And what we're looking for normally is to see a smooth curve to the front here. So if we trace along the vertebra, we should see a really smooth curve towards the front, okay? If we have a spondylolisthesis, spondylo means spine, listhesis means slippage, okay? So there's going to be a break in that curve. So we can see here, as we trace along, there's a break at L5, okay? There's usually some type of injury to a back part of the vertebra here, and we're going to take a look at what that is. So we have a model of the spine here. This way is forward, this way is backward. Looking at the top here, this little joint right here is called the pars, okay? This little bridge here, and these are usually the spot of injury that causes that vertebra to slide forward away from normal. So there's three main ways you can get this. You may be born with a congenital defect at the pars joint here, allowing a forward slippage. You can have a degenerative process, meaning arthritis is setting in, the discs are wearing down, these joints start to atrophy and can snap and allow the joint to move forward. By far the most common is an isthmic or a repetitive strain to the pars joint here, okay? We see those a lot in weightlifters, gymnasts, football players, people after some type of trauma, like a car accident, falling off a horse, a trampoline, and anything like that, okay? You may hear like a pop in your lower back when you feel that too, okay? So they're graded in severity from 1 to 5, 1 being the least severe and 5 being the most severe. And we're going to take a look. We've got a couple images up and see what kind of signs and symptoms you'll have with those different grades, okay? So let's look at some X-rays here. So this is the lumbar spine from the side, the low back from the side. Again, this way is forward here. And this is a normal image, okay? So if we trace along here, we see a nice smooth curve. That's what we want to see, okay? This here is a grade 1, okay? So again, this way is forward here. And as we trace along here, we can see there's a step off here. So L4 has slid forward on top of L5, okay? This is by far the most common one that you're going to see is a grade 1. It's usually a little intermittent low back pain, not a lot of neurological symptoms present. They respond very well to conservative care, like chiropractic adjustments, bring these joints back into a line, rehabilitative exercises, strengthen the core, the perispinal muscles, decompression as well. Works fantastic in these cases. Typically no need for any type of surgical consult at the grade 1 level here. Let's take a look at grade 2. Okay, so this is the same thing. This way is forward here. And again, we see L4 has slid forward on L5 just a little bit further than the last image. There's a fracture here at the back of these joints. Okay, the lamina is fractured in the back here, allowing that joint to slide forward. This patient's going to have more pain than the grade 1. It may be more frequent. They may experience some radiating pain down the leg, one leg or both, some numbness and tingling. Not too severe neurological symptoms, probably not any bowel or bladder issues or weakness in the legs at this stage. We treat these in the office here conservatively. They most of the time respond well. You just need to do a lot of rehab exercise to strengthen the muscle in the core to hold those joints stable. Okay, let's take a look here. And the next, this is a grade 3, a little bit further slidage forward. This is forward here. L5 has slid forward on the sacrum. This patient's definitely going to have pain, okay? There's going to be some neurological findings present, probably some weakness in the legs, one leg or both legs. It may feel like your legs kind of want to give out on you. In this case, typically they're going to require some type of surgical intervention if an initial round of conservative care doesn't provide the results you're looking for, okay? Let's take a look at a grade 4. Now this one's in the opposite orientation. This way is forward here. This is L5. This is the sacrum here. We can see this joint is slid way off of that joint. This patient is in severe pain. Is probably already in the emergency room here. Definitely needs surgical intervention here. So what do we do? The definitive diagnostic is a lumbar X-ray from the side, a lateral lumbar, to see if there's a forward slippage. Okay, so if you think you have one and you want to get it checked out, you can go visit your physician, you can visit your chiropractor. They're going to do a physical examination, a lot of orthopedic testing, looking for radiating signs and symptoms and weakness in the lower lumbar joints. This is where these most commonly happen, is at L4 and L5, the lower lumbar spine. We're going to check posture, range of motion, palpatory exam, and a lot of neurological testing. So we're going to check for reflexes, muscular strength deficits, radiating pain, numbness, paresthesia, along into the lower extremities. So, like I said, by far the most common are type 1 and type 2, with type 1 being the most common. Those type 1 and 2 respond very well to non-surgical conservative treatment. Typically it's a couple months of care consisting of decompression, rehabilitative exercise, and chiropractic adjustments to get those joints back into alignment. Okay, if that fails, then we'll typically refer the patient for a surgical consult to see if they're a candidate for a lumbar inner body fusion or a lumbar fusion surgery. So what is that? So if this joint has slid so far forward that it's actually compressing that spinal cord and the nerves that come out, and conservative care didn't work, the surgeon can come in, reset that joint here, drill here, put a plate, hold them together, so these joints no longer slide forward. There's no longer any neural compromise there. So we got a picture of a post-surgical X-ray. I want to show you what that looks like. So here, again, this way is forward here. We see L5 and the sacrum have been fused. L5 had slid forward, and the surgeon reset this joint here. Okay, some of the downsides for that is this joint has virtually no motion. Okay, so the joint above it is going to have to become hypermobile to make up for that lost motion, which may lead to degeneration in this joint later on. So you definitely want to consider a conservative course of care prior to surgical consultation. So if you guys know anybody that this might help, please share the video with a friend. Post your comments down below, and you can give us a call with any questions or to create an appointment at 256-822-1010. Thanks a lot. We'll see you guys next week.